This is to allow for the opportunity for folks that may not be able to be here today to participate and be able to get the same level of information as you were able to today, and also benefit from whatever questions you may have today about the project. So I'm going to go ahead and get us started to be respectful of your time and keep us moving. I'm actually going to bring in my colleague, Andrea Howerton, who's going to get us started in this conversation today. Andrea?
Thanks, Swamirs. Hi, everyone. My name is Andrea Howerton. I work in the DCHS Contracts and Procurement team. I'm one of two RFA leads to helping out Swamirs. Deborah Autumn, my coworker, is also a lead on this. She's not here today, but we'll both be available to answer questions. I just wanted to let you know that I will be monitoring the chat. So if you do have questions that come up during this session, please feel free to use the chat feature. Or if you'd like to raise your hand or unmute yourself, that is fine too. And then we'll also have time at the very end. All questions and our responses today will be recorded, and we will upload those onto Zoom Grants as an amendment to the RFA. So look for that, and we'll probably send a communication out when that is uploaded as well. So to get us started today, we're here to talk about, we'll give a little bit of a background on this RFA. I'll give a little bit of information regarding the Zoom Grants and the application process, because it's a little bit different if you've ever applied for one of our procurements in Zoom Grants. This RFA is doing a little bit different, and then we'll do questions and answers at the very end. Again, my name is Andrea Howerton, she, her pronouns. I'm joined by Swamirs, the Mid-Community Partnership Manager, and then my other team member in the contracts team is Deborah Autumn.
Thank you very much, Andrea. Everyone, my name is Swamirs Brian Guzman. I'm a licensed behavioral psychologist, and I am the Community Partnerships Manager with MID and BHER. My job is really to create community around the mental illness and drug dependency unit, and also spearhead several different initiatives, including what we're calling the Rural Expanded Behavioral Health Services Initiative, with the based on the name, but it is specifically to meet the unique needs of people living in rural areas of King County. A little bit of background how this funding or this RFA came about. It really is an acknowledgement of how the COVID pandemic has exacerbated many of the different, behavioral health challenges across all the different communities, particularly in rural communities. We have seen a increase on depression, anxiety, anger, PTSD, disorder, and substance use challenges, specifically in rural areas. We also have seen the rural residents also report often comorbidity issues between behavioral health challenges, medical challenges, and other challenges people may experience due to the lack of services or access to healthcare and other services in rural areas of King County. We also know that given the challenges of the COVID-19 pandemic, this funding is crucial to meeting the unique needs of rural King County, but also this funding is responding directly to community identified needs. I'm going to talk to you about that community engagement process in a moment, but kind of as a background, this is what we're hoping to do is addressing the COVID-19 challenges, the behavioral health challenges the COVID-19 pandemic has brought us. So, agencies may propose projects to address behavioral health challenges, substance use challenges with the nexus of COVID-19. How are your projects or services are there for helping the overall community in overcoming the challenges as a result of the COVID-19 pandemic? Now, when we're looking at the purpose of this RFA, the specific purpose is to increase the culturally and linguistically relevant services and enhance programming for youth in all of the 6 community service areas. We're going to talk about what that looks like in a moment. And we also see the Arson and unincorporated King County, and both we're hoping to increase capacity in both rural and unincorporated areas of King County, and increase systems and service coordination within rural and unincorporated areas, and seek to identify local conveners to bring in to start collaboration meetings in each of the community service areas. As mentioned, this RFA is a direct response to a community engagement process, a community assessment that we engaged in last year. We're going to give you very specific details on that in a moment. We may also be providing some information as it relates to the assessment that we included. A caveat with that assessment is that King County is not predictating what services to provide, what evidence-based practice to use, or promising practices to use, or what interventions to provide. We really want to provide kind of high-level information on what the community has asked for, and for the providers to develop programming. They're stemming for community needs. They're stemming community from the people you're serving, either through services, either through community engagement assessments, or understanding people's need, and then submitting an application to us that is responding directly to community identified needs. Now, I wanted to give you a very specific, under this funding, we have very specific guidelines on where this funding can be utilized or can be used to meet the unique needs of people. For the purpose of this RFA, we are making all community service areas that contain a rural area eligible. So there are 7 community service areas that the Department of Local Services have determined as unincorporated, urban, and 6 of those are actually rural areas. They are a part of the West Seattle area you see here in blue in the screen. They is considered a community service area. However, for the purpose of this RFA, they are not eligible for services. Okay, so these areas that you see here are all of the different areas that we are able to serve, anywhere from the Bear Creek to Mamish area, the North King County, the Snoqualmie Valley, Northeast King County, which is the green area, the orange area, which is the Fort Creek Tiger Mountain, Greater Maple Valley, the red area, blue Southeast King County, and Vashon Island is on yellow on this side. So all of these are the actual community service areas. This initiative also makes these cities or adjoining towns also eligible for services. So all that to say, the people eligible for these services must be living in rural areas of King County, either in a community service area or an adjoining town. And this is very specific, and want to make sure that we know that these RFA really was driven by need of the community, by the community coming together and expressing and really sharing their needs, not only what was working, what was not, but also, more importantly, provider recommendations, direct recommendations to King County on how do we as King County then step in to provide services or fill in the gaps that exist in behavioral health services, and also how do we then provide systems for providers to develop partnerships, relationships, and collaborations that will allow for service consistency and avoid service disruption, especially in rural areas. We recognize that rural areas struggle with service availability, also getting to services coming from rural areas to urban areas is often a challenge for people. So a lot of what we're hoping to do with this initiative is that we're hoping to provide services in their community service area, whatever community service area that you choose, you will be able to serve in. And we want to make sure that that you have that experience or the qualifications. So do you understand the local context of what is happening in each of these community service areas, and how you are uniquely positioned to meet the needs of that community and contribute to the overall opportunity to contribute to the COVID-19 pandemic and really supporting the behavior modification challenges communities are experiencing at this moment. Now, so as far as eligibility, this is your eligibility. This is the people living in these areas are the only people eligible for services under this initiative. Now, moving us forward, We spoke to, in preparation for this allocation and for this program, MID or the heard also engaged in a community engagement plan that really looked at talking directly to community, to talking to people in recovery, peers. We talked to people who are consumers, people who identify either peer consumers or family members of people in recovery. And additionally, we did several listening sessions with providers. We wanted to understand also the challenges providers experience in rural King County, and also how again, King County can step in and to mitigate some of those challenges providers experience in the provision of care and services in rural areas of King County, and acknowledging funding challenges and other. This is the first funding that we are putting out there, responding to community needs, and we expect that we're going to learn a lot from this process, and we are hoping to really utilize your processes and your information and the information you provide us, not only to develop a deeper understanding of the challenges in rural areas, but also for you to provide recommendations on, for example, we are asking for you to provide a sustainability plan, but we also said, hey, if you don't have a sustainability plan, please tell us what type of sustainable continuum funding will be ideal for you to keep service consistency in the area that you provide services. That is important to us. We want you to really be creative and really think outside the box and tell us what type of funding structure will really work. And after this funding is done, what type of funding structure will work for you to keep the continual services and avoid the disruption of services in the area that you provide services to. So use the application both to tell us what the project is going to do, but also tell us, paint us a picture in order for us to continue to do this work. This is what we need. This is what this funding can do now. This is what the funding what the sustainability looks like in the future. These are the type of things that we're looking for in order to better serve the community. These are the things that we need, right? So I ask that you be intentional in the application and tell us specifically as a provider what will work and what doesn't for you. Lastly, I will mention that we also conducted, in addition of the community listening sessions and the provider listening sessions, we actually conducted a rural behavioral health assessment that looked at receiving responses from all of the 6 communities service areas, which is, to me, it was interesting and cool because we really had every community service area speak up and share their truth and ask questions and provided the recommendations for the panel. So we received the 700 responses. We had the survey available in multiple functions, either text, mobile, and computers. Either way, the folks felt that was best for them to complete the survey. We had the ability to do it, and ultimately we also had responses in multiple other languages. Now, through this community identified process or community plan, we identified 4 key needs that community identified to us, and it was the provision of behavioral health and substance use services locally, so that community members do not have to travel to urban areas to seek care. So and in this point, we actually have a couple of things working. We wanted to see it working in this RFA, but we also have mobile services that are combined with other RFAs that they're out right now that will also respond to this with 2.A. 2.B, tailored community-driven outreach and engagement activities to the unique needs of rural residents. This is important. We really want to ensure that all the services that we fund do have some type of outreach and engagement plan that really understands the unique challenges rural residents experience in seeking care, but also just their unique challenges in community, whether if they are geographically isolated from services, and how do we then make sure that they end up with information that in the case they need mental health services, they know where to go to. So we want to make sure that we are tailoring that community-driven outreach and engagement to rural communities. We wanted to see also that increase access to telehealth services. We know that during the COVID-19 pandemic, these telehealth services really were an opportunity to to really provide services to people who traditionally have not been able to be served or live too far from other services, and telehealth have been allowed to do that. We want to see a portion of this in your application, but we are also doing something separately on these, where we may providers who end up getting funding from us will have the opportunity to draw some funding from MID, for example, to help your clients with a telehealth access, whether if it is a phone, a tablet, computer, whatever they need in order for them to engage in a service with you. We have the availability. We just want to make sure that in your end you think about that, and that and you have the capability to provide the telehealth services. And whenever you encounter somebody that does not have the hardware, internet, or whatever to engage in services, the youth come back to us and says, we need this support, and we do have set up some funding aside to be able to respond to those situations in a case-by-case basis. Additionally, we saw again, attached with the telehealth services is the increased access to adequate internet and hardware. So again, we want to see you have the option to telehealth services, and in the case people have need or have the need for the appropriate hardware for internet service, you will come back to us for that, and we'll provide the appropriate support. Additionally to the community identified needs, we saw that there was the need for create and increase a community identified pro-connection, anti-isolation program intended to build connections in culturally and linguistically diverse communities. And in this case, what we're really looking for is anything that is outside, what type of programming those rural King County need in order for rural participants to build community, to really to move away from this isolation that COVID-19 gave us, and to reintegrate into community by starting to do group activities. For example, you can we have seen some cool, interesting projects where they, don't take my idea, but like, for example, whether if you are doing a behavioral health garden community, where, people from that community come and talk about gardening, but also address behavioral health challenges and things like that, right? But it's really about, is it thinking outside the box? What works in your community? How can we create this space for people to create these, to create connection, to let go of the isolation, and to really intend that and to rebuild connections with their community. We want to see the particular thoughtfulness around making sure that you're reaching people in culturally and linguistically diverse communities, whether people of color, immigrants, refugees, as at least other communities also who have a struggle with isolation and connection issues, given that we have refugees living in rural areas, for example, that were resettled into the United States during the COVID-19 pandemic, and they haven't built community and they haven't built connections and stuff like that. So, we're looking into how do we build that community back up again through this programming, rather than focusing on the behavioral health part of it, is building the connection and anti-isolation aspects of it. Also wanted to see the expand and establish new youth programming and innovative approaches to reaching youth and serving youth. We, all that to say that we, the county has many behavioral health programs in rural areas. Some they are for youth. They are already youth interventions. We're also, MID also has currently, there's another RFA for youth prevention, youth suicide prevention training. So in this specific RFA, on this specific point, what we want to see is a new program, something new, an innovative or a new way, or a youth-driven programming. It doesn't have to be new or innovative. It can be a youth-driven programming. It can be something new that you see that is working in a different community that you want to bring to your community, but really is to establish a new one, or if you already have a good project that could use an expansion, and telling us that, but also connected with the community. Why do expanding the current project will be helpful? Right, we will need to know the numbers, whether if you have data to contrast that, so you can give us a full. I guess what I'm trying to say to you is that please allow the review panel to make informed decisions by providing us the full spectrum of information, provide us contrast and information, whether it's data, literature review, point us out to something and connect connect the community identified priorities that you see here in your application to your services. Connect them very well and tell us how does your services respond to these community identified needs, and how does responding to these community identified needs then therefore support our efforts to reduce the symptoms and challenges that the COVID-19 brought us. So really being outside the box and thinking about what this looks like, but we also wanted to see both participants and providers told us something very interesting and important to us. They wanted to see us to strengthen our collaboration between behavioral health providers, social services, and other formal and informal systems of care. This was important to us, and it took us a little bit to kind of contextualize what this means, because providers want us to make sure that wanted to work in collaboration with others to avoid kind of these funding silos or kind of funding competitions and so on, but at the same time contribute to their overall community collaboration and strengthening the ability to work in collaboration. All of that to do two important things. Number one, avoid service disruption and keep continuity of services. That is one of the big things for MID. And you heard, I guess, from our perspective, continuity of care in rural King County and how do we avoid service disruption. So keep that in mind. Tell us your story. Tell us what's working, what's not, and tell us how King County can step into that and fill the gaps that exist. Now, in these RFA, you will see that there are three forms of funding. They are, number one, there are 3 grants for culturally and linguistically appropriate wellness programming. There are 3 grants for youth programming, and they are another grant for what we're calling the Rural Behavioral Health Collaborative. But anyways, let me take a step back in here, talk about the first 2 programs. So the programs in the 2 programs in this RFA are culturally linguistically appropriate care and youth programming. Both of them, as we share, kind of are this can be, it can be a youth program, culturally linguistically appropriate youth programming, or vice versa, right? What we really want to do is wanted to have our grants or applications that are really focusing on expanding our care to people culturally and linguistically appropriate wellness programming in rural areas of King County. And what we're saying in here is that yes, care about the behavioral health system, but also let's acknowledge that we are wellness programming. It's more than behavioral health. It's also and we want to make the acknowledgement to you and let you decide as the expert in that community what is the appropriate wellness programming in that area that you're looking to serve. We also see that there is, we have the program for youth programming, and this again, we're looking for evidence-based, promising, or innovative practices to support youth and youth living in rural areas. Evidence-based practice, we already know what that is. It's a well-established practice that it has research and evidence that proves that an approach works, but also with the caveat that most evidence-based practices haven't been tested properly on people of color. So while we know about evidence-based practice, primarily based on our perception of how it treats non-people of color. So it's important to acknowledge that. And while promising and innovative practices allows for to develop new evidence and evidence. So let me take a step back. Promising innovative practices, we defined it as a practice to which you have evidence that works, or that you have initial evidence that your approach works to providing the service, but you're seeking funding to develop additional results or additional evidence or data that supports your evidence, for the programming. So really, it's important to note that we really want to see evidence-based, but also we wanted to see a portion of you trying new things and developing data that suggests that, hey, providing this specific youth intervention in rural area works, and this is why. And remember, this is how we, whatever information you provide us, this is how we make decisions in the future. It's really feedback oriented. So we really read your applications. We ask you questions with intentionality, like the questions about sustainability. If you're not sustainable, tell us what type of funding will be able to keep you sustainable, to keep you providing services. So use your application to provide us not only what are you going to do, but also recommend how do we continue to improve our ability to serve people in rural areas of King County and keep you providing consistent services. Now, to move forward, just for the purpose of the culturally linguistically appropriate services and youth programming, the populations intended for that program, for those programs, are really youth and their families living in rural King County, and rural residents in general who will benefit from services that promote connections and wellness. So population number one is specifically to the youth programming, and number two is specifically to the culturally appropriate, linguistically appropriate services. But the reality is that any youth in rural area or any person in rural area who is in need of services, but if they identify with the age range for services you provide, you're welcome to do that. But you also are able to align within this spectrum of who you are able to serve, depending on the grant that you receive. Now, moving us forward, there is one last scope of work on this RFA. There are 6 grants under this one, and this is what we're calling the Community Service Area Specific Behavioral Health Collaborative. What we mean by Community Service Area Specific is that we're looking for 6 behavioral health collaborative leads out of the 6 community service areas. So other grants, other projects, they're serving all of the different community service areas. The projects under this initiative, you have to select one specific community service area that you're going to serve. My other RFA, the suicide prevention and peer services, that one is different than this one. So this one is very specific to, we're looking to 6 RFAs. You must select what CSA you're going to serve. And our hope is that we have one lead at each of the 6 CSAs, preferably a lead from an agency that is embedded in that CSA, understand the challenges of that community service area. And that is a trusted collaborator in that area, and that is willing to bring community together. So the collaborative lead is will be the main convener in the community service area. Let's say we choose, one applicant may choose the Northeast King County Community Service Area. That convener is going to be in charge of doing outreach to all the different behavioral health agencies, community service agencies, whatever agencies there are in that community service area. Their job is to invite them and have them be part of this collaborative behavioral health collaborative. The primary activities are going to really be about improving the relationships and the way the behavioral health agencies collaborate in rural areas. We'll also talk about improve coordination for care, referral services, identify and jointly solve other access issues and service challenges. And this really comes from what the providers in rural areas have asked for. Right? Like really, they wanted us to include, in order for us to really make efforts to avoid kind of the silos and work and competition and stuff like that. We needed to bring them all together and to really work together and to identify the strengths and experiences of each, and really cultivate those experiences and collaborative move forward to better serve that community. So the participants who are going to, the leads are going to invite, the agencies that are going to be invited to participate in the collaborative will actually be compensated for their time. So you're not asking anybody to join for free and to provide their expertise. You're going to be allowed to be given a budget to pay for each of those providers for their time and expertise to attend the collaborative meetings in order for, and to really engage in these activities, engage in the collaboration, improve coordination, and do all the things that the collaborative really wants to do. Again, with the idea to enhance our partnerships and collaborations in those rural areas of King County. Now, for this specific scope of work, any agency from this agency is eligible to apply for them, either a behavioral health agency, social service provider, religious institution, wherever. Any of these agencies can come forward and apply for the Community Services Collaborative. We want to encourage, however, a behavioral health agency to be the primary CSA collaborative lead. And also, the lead will be able to invite agencies that fall within these categories to attend the collaborative meetings. So basically these are the folks that the collaborative will be able to invite and will be able to have and be part of the collaborative meetings. So I have one more slide here. I want to make sure, and I don't see any questions yet, but we're going to have a section for questions and answers specifically. So we're going to go ahead and continue going to through the content. If you have any questions, please feel free to put them in the chat box. Now, for this RFA in general, we want that the most competitive applications will address for us why the project was chosen and how it meets the community identified priorities and needs as stated in the objectives of the RFA. This is important, folks. We really want you to connect how does the services you're proposing to provide are responding directly to the community needs, whether community needs that you identify and then connect it to the community needs that we identify on the RFA, or you're responding directly to the community identified needs identified in the RFA. But we want to see that connection. We want you to tell us how did this came about? How did this idea came about? You're telling us either folks, some in our normal course of business, our clients told us that they were experiencing these challenges and recommended that we provide this service, and as a result, we're responding to our community by applying for this funding. But it can be as simple, really directly as that, or you tell us like in 2022, we engaged in a 3-month process of understanding community needs and did a community assessment as a result, and then we put this whole project together. But it's really to provide that whole concept and tell us the idea, how did this came about, connected with the RFA, connected with the community identified needs. I will always tell people applying for my RFAs is to use the language in the RFA. The review panel really wants to read their words in your application. They want to see the direct connections between the application and the RFA. So use that and really and make that full case to us. We want to see the existing health, and we want you to address the different health inequities that exist as a result of the COVID-19 pandemic, or they have been exacerbated by the COVID-19 pandemic. So really identifying what are the health inequities happening in your community service area. The RFA did mention a lot of the different comorbidities or health inequities that are there, and also cite many different research documents that would provide you with additional information. So look at those, please, and but also we ask that you on your own also express to us what are the specific inequities that your community service area experience. Well, we also wanted to see how the project support the efforts to address the challenges as a result of the COVID-19 pandemic. A direct answer: how does these by us doing this specific intervention as results, people be able to reconnect or be able to build connection and build and get back into our community and after 2 years, you know what I'm saying? Like, you just really connect it all, really bring it home to us and tell us how these efforts will address or support the efforts to address the challenges of the COVID-19 pandemic. integration. Also wanted to ask you to think outside the box. Think about the integration of programming or services into a non-traditional setting, whether if it is a school, community center, church. This is a specific. This is something that we heard a lot from folks. Is that there is a model called hubs and spoke model, where you use a library perhaps as a host place for once a week in a community where there's traditional services, or a church on a Saturday you go, and that's where you're based out of, right? Really providing, thinking about where community is at and where can you best serve community, and then putting forward a program. I'm sorry about the numbers. they do not match, they're just funny, but please, this is, yeah. Also, outreach strategies and services delivery and culturally and linguistically diverse communities, including how will language need to be met. We are not saying to you, you must provide the service in language. We're saying, tell us if in your community service area you have Spanish-speaking folks, community members, and you have Spanish-speaking team members. Tell us that. Tell us, a Spanish-speaking team member who will be able to provide services to our community, or be very specific. Or our services are also adaptable and easily translatable to other communities. We to people of other speaking other languages. We currently have a contract with so-and-so agency to provide over-the-phone translation. But really tell us that plan. We don't. We don't want you to stress about it. You don't have to allocate a lot of money to this, but allocate some of that fund. Think strategically about how do we make sure that our services can be translated or can be interpreted to somebody else appropriately and in a way that is culturally and responsive to their needs. So I'm going to pass it on to my colleague, Andrea Howerton. Again, please feel free to put your questions in the chat box. And we're also going to have a section for questions and answers at the end. Andrea?
Yes, thank you, Swamirs. Again, that was a lot of content information, so I just want to pause for a second to see if anyone wanted to unmute to ask a question. Because that was a lot of information to digest all at once.
Thank you. Yeah.
And if not, that's okay. We can keep moving on. But
I think I'll step in. This is Summer from NAMI Washington, the National Alliance for Mental Illness. And you speak a lot about collaboration between different entities, especially with the CSA collaboratives. And I'm just wondering, our organization is probably not as in depth into these communities to be a lead, but we would definitely want to be a supporter for, because we can offer evidence-based training for mental health support groups and things like that. So I'm just wondering how you're connecting organizations that could be collaborative partners in this process.
Thank you. Yeah, so that is a very good question. And this is kind of like where so last year we had a presentation or a session where we did a meet and greet, where there was an initial conversation where folks that were interested on both of the RFAs came in and had the meet and greet. We don't have that schedule. I don't know, Andrea, is that something that we can do during the procurement process? Kind of.
Yeah, if that's something you'd like to do, we'd have to schedule that out and announce it to everybody.
Perfect. Yeah, actually, that sounds like thank you very much for putting that forward. I think that we'll love to put another meet and greet together, maybe in mid-April. Unfortunately, I'm out all next week, but maybe on the week of the 11th, I can attempt to do something, just a meet and greet for folks to meet each other. Let me put something together and I will respond to everybody who was here today. Oh, actually, no, we're going to put it in Zoom grants, right, for everybody to know.
Yeah, it'd be for everyone. Yeah, not
Perfect.
Just everyone here, but everybody that would be interested. Yes.
Thank you very much. Are there any other questions we can answer? Okay, well, feel free to put them in the chat box as we continue with the presentation.
Okay, so here you'll find the high-level timeline for the RFA, obviously subject to change. And if we add that meet and greet, we can add that to our timeline as well. But the RFA was issued on St. Patrick's Day on March 17th. We are conducting this applicant workshop today. Final day to ask written questions through either Zoom grants or directly to email to Deborah and I is April 20th. So the applications are due on May 3rd at 2:30 p.m. And we do that during the day in case there are any technical issues or things aren't working in Zoom grants, someone is available to you to work that out. We'll then have the review period between May 3rd through June 10th. The notification of awards will be in June of 2022. And if that is changed, we will definitely let everyone know, and hopefully have a contract start date on or around July 1st of this year. And there's a question in the chat, Swarmiers, about can organizations apply for more than one grant?
Yes. So yes, organizations can apply for more than one grant. We ask that if applicants are applying for, let's say, and these are a specific RFA, are 3 specific scopes. If you're applying for all 3, we ask that you complete a separate application for each project, for each scope that you're applying to do, and that is with the hope for us to review and score each application on its own merits, and that also will ensure that that it may be your organization has a stronger proposal for the youth program and perhaps a little weaker proposal under something else. We want to make sure that you're funded for at least one scope, and even if another scope is rejected. Jamie, I'm sorry, Johnson, does that answer your question? Yeah, okay.
Yes, it does. Sorry, I was having trouble finding the mute.
No problem. Yeah.
Thank you.
Thank you.
Next slide, please. So the review process for each application, once the deadline is passed, is first we will go through, Deborah and I will go through each application for an administrative review. And basically that just makes sure that everything that's required is submitted, and each application meets the applications that's described in the RFA. If we see any discrepancies or there's something not clear, we may reach back out to you via email to ask for any clarification. Once all the applications meet the administrative review, it'll then go to our review panel, which will score each application based on the criteria that we'll show in the next slide or so. We'll then take the highest scoring applications and recommendations from the review panel. If there are still questions after the review panel, we may choose to schedule interviews with the applicants just to clarify anything that maybe we missed or needed to be explained more. And then once we have recommendations, we have to take that to our DCHS leadership to put their stamp on it, and then we can announce the awards. Here is the rating scale that each application will be reviewed on. It's a 0 to 5 scale. And I believe the scoring weights and total amounts are described in the RFA document. And you can find that on Zoom grants.
Andrea, can I answer a couple of questions?
Oh, sure. Sorry.
Yeah.
Yes. Oh, yeah. Who sits on the review panel?
Yeah. So there is a variety of people who sit in the review panel. We have folks from the Behavioral Health and Recovery Division, Finance, Performance Measures and Evaluation. So we really have a host of folks. They are part of our panel who come from different experience, but also diverse in both in their own experiences and in their own persona. And also we may have some representatives from the council members on they represent rural areas. They are non-voting council members, so they just sit there and know what's review the applications, but they do not make funding recommendations. the last question, Summer, I think I would direct you to the RFA. The RFA has contained kind of like the specifics to all of the funding amounts to each of the different of the 3 different programs. With the caveat that we did keep some of those resources in our end. So whenever if you're providing services to somebody and they need additional support, then you will come to us and then we'll provide that support in order for them to benefit from the program. Any other questions on this process? And just in the review criteria, I just kind of make a quick comment. I ask that do you strive to give us an above average response where you're giving us a thorough and complete response that demonstrates not only the acknowledge that is what is on the RFA, but also you acknowledge full the community that you're going to serve, the challenges that community experience, and the specifics and the and perhaps whatever you can tell us about the community and how this project will contribute to the success of that community in general. Next slide. Hold on, there's a question, maybe a question. Let's see. There's another question before I move forward. Are members of the review panel familiar with the individual rural communities? Yes. So we do have. We have review panels that they are familiar with rural areas in general. I don't know if we have individual folks living in old rural communities, but we do have folks that are working, are overseeing programs in rural communities. For example, folks that are living in rural communities and are part of King County or part of the Behavioral Health and Recovery Division. So short to answer your question, Jenny, yes, our members of review panel are familiar with the community, the different community service areas and the challenges each of those communities experience, and the lack of services perhaps and some of them also may have. Thank you. Andrea, we move forward to the next?
Yes, please.
Mm-hmm.
So for this RFA, the application process is a little bit different. As I said at the beginning, if you've ever used Zoom grants for any of our previous procurements here at the county, right here is the link, and we can also put that in the chat if you have not seen or visited the RFA link on Zoom grants. Oh, you just showed a picture of your so what we are doing different with this RFA is that the questions will not be answered directly in Zoom grants. What we're asking is we have the narrative questions in attachment C located in the RFA document. And we're offering that you can answer the questions in your own document, say a Word document or PDF or anything that can be saved, and then upload them into the Documents tab in Zoom grants. So it's more of self-led question and answer instead of answering the questions directly in Zoom grants. And I'll show you exactly where that is in just a second. Also, upload is the budget template. There's a budget template on Zoom grants. If you just click on that, download it, fill that out, and then you can upload that back up to the Documents tab as well. So both documents, the narrative questions and the attachment D budget will be uploaded into the Documents tab. Next slide. So the due date again is no later than 2:30 on May 3rd, 2022. You're all responsible for regularly checking Zoom grants for any updates, clarifications, or amendments, such as the questions and answers that come out of here. We'll try to send out a communication when we do upload an amendment. However, I suggest that you regularly check Zoom grants just in case that communication doesn't get sent out right away. If you are experiencing any technical issues with Zoom grants, please email Deborah and I at this email address, dchscontracts@kingcounty.gov. We'll first try to help troubleshoot the issue. If we can't figure it out, then we can contact Zoom Grants directly. They're a third-party administrator for this system, and their help desk is usually very responsive and helpful. So again, just make sure you allow yourself sufficient time to upload all of your documents and required information in Zoom Grants, just in case there are any technical difficulties.
Are we doing this? I have it just in case in here, but yeah.
Oh, sure. If you want to do it.
Yeah, I just wanted to. This is the link. Once you're in the link, it will take you to this package. You can. If you apply, if you hit here apply, it will create an application. It will create a profile for you to go to download everything, or you just can download. Oh, what's happening? Sorry, it's getting a little slow here. I will show you where the full package is at with all the different attachments, so you can download those and create your own application and a Word document, perhaps. Here's the package. So anywhere from this is the RFA, the federal terms and conditions, the summary questions, mostly about your organization, and the actual narrative questions that go that review your program. Okay. And also there's the budget template that you'll be able to use. As far as the application, you create your profile, and then that is where you upload the application to the system. We ask that you come here as often as possible. You'll be able to see everything that you need to know here about the application and documents or other amendments that we may be able to issue.
And that documents tab that you were just in, if you scroll down, Swamirs, right there, that's where you will upload all of your required information for your application.
Perfect. Let's see. Okay. Are there any questions? Guess we can go back in here. Any questions or additional comments that we can make or clarify information that we can provide you? Oops, what is happening? Okay, so it sounds like we may have provided you with all of the information you may need to hopefully help you make an informed decision to pursue this funding. I guess in closing for my end, I would like to share that just a reminder that this RFA is a direct response to a community identified needs. We engaged in the process. We were intentional about talking to people in recovery, people, consumers, peers, and their family members, people in general who were interested about behavioral health, to provide their feedback, their recommendations, and we were really. We'd like to recognize how the strengths of rural areas, their strengths, their abilities, not only to organize, but also to come forward and speak their truth and seek to better their communities. I asked whenever you're applying for this funding, they apply the same respect to the process that we applied to, really acknowledging that communities are best positioned to respond to their needs. This funding, it's really it's one of the first acknowledgement that we were making in Rural King County, and we really look for your participation and your support to make this a successful program in Rural King County. I think that your success or the success of this program is what really is going to allow us to kind of seek what type of consistent funding we can keep for Rural King County to continue to fund your services. So for now, thank you all very much for being here and present with us. Please feel free to email us. Remember, as a last reminder, you have until April 20th, 2022, as the last day to submit your questions via email to dchscontracts@kingcounty.gov. Please, you will hear directly either from Andrea Howerton or Deborah Adam. Let's see if there's some. Other than that, thank you all very much for being here and present with us. We appreciate you and we look forward to reviewing your application. Thank you, Jenny. I appreciate you for all your questions. Thank you, everyone. Thank you.
Thank you.